Hi, it's me, Ingrid INFP, and I'm at my ISFJ friend's house. So the decor is a bit different. I hope that you can see this beautiful painting. It's Stockholm and Venice in the background. And that's because my friend is Italian, so he's not from Venice, he's from the south. I think he would like me to point that out. He's out at the moment. I was at the Heart-Lung Days in Stockholm for 2 days, and it's sponsored by the Heart and Lung Association, the Hjärt-Lungfonden, that is turning 120 years here in Sweden. It was at first created to combat tuberculosis, but as tuberculosis got less and less common, it's now really into cardiovascular disease and COPD, lung disease. But they still take care of tuberculosis and such, but it's not the most important thing here in Sweden. So, I'm going to be talking about medical things, and this video is dedicated to Schumann, but also to INFPA insights, older INFPA insights for their dedication to medicine. Okay, they like my medical videos. I know that they're not as popular as other videos, but that's what we're going to do today. So we're going to talk about, what's cool is that we got where we have the name of the picture of the person that was doing the lecture, and then they said the title, and there's a little summary already done on the notebook. So, and they were just 1 page per lecture, and the lectures were 15 minutes long each, so it was quick. It wasn't long and boring, which these things easily can be. So the first lecture was kind of a general lecture about connecting the dots between nature's intelligence, how we can use nature's intelligence to improve our planetary health. And what he was talking mostly about was about how the Earth's health should be coupled to human health. And there are certain things where human health is not correlated to planetary health. For example, COVID-19 was really something that affected our human health, but was maybe kind of good for the planet, at least temporarily, in terms of less greenhouse gases, since people couldn't go outside. So that's an example of that. Another example, which would be the opposite problem, is that if we were going the total natural way, we wouldn't be able to have industry to create medication that has saved millions of human lives. So, but the best is if we can find the win-win situations. And so there are certain interesting things that you can find in nature, like animals that don't change fast, animals that don't age, such as there was a sort of shark that lives 400 years, and a lot of marine creatures live a very long time. And so if we can learn what it is that makes them live long, then we might find a way to treat people. So there was a gene, a molecule called NRF2, which these animals have. Also with the gut flora, the bacterial microbiome in your gut is important, but we don't know much about these things yet. We also know that there are a lot of fruits in the Amazon that could have healing properties, but if we take down the Amazon, like if we destroy the Amazon, then because we went to eat red meat, which also isn't good for your health, then basically, well, both we die and the forest dies. What that is called is biomimetics. It's that there are solutions in nature. So plants are medicines, but also poisons, such as the digitalis, is a digoxin, is used to treat heart arrhythmias, because the poisonous part of it was the thing that was creating a heart arrhythmia in people who didn't have heart arrhythmias. But for people with heart arrhythmias, this can actually help the heart. So medicines, poisons are sometimes the same thing. Also, we're seeing the eating habits of animals can help us in figuring out what is the best eating strategies for humans. And a lot of it is epigenetics, which is about how genes are affected by our environment. So, for example, a lot of people maybe had an individual risk for COVID, but then they got, they had a risk for a certain disease, and then when they got COVID, then suddenly their system got like triggered pretty much. And we don't know about this. For example, tuberculosis, it comes in a later lecture, but tuberculosis is a latent disease. So a lot of people are like, don't know that they have it, because they are like resistant, like they are somehow managed well on, even though they have tuberculosis that is latent. But then they might get immunocompromised for some reason, and then suddenly they get like the symptoms of tuberculosis. So there's that. And we're trying to avoid premature aging, which is often something that we see a lot in people with low socioeconomic status, people who smoke. These things make your cells like grow older faster. And all of these things, global warming, air pollution, water pollution, ultra processed foods and such, leads to all of the diseases, basically. You become older because your cells create molecules that are toxic for you, basically. There's oxidative stress. I'm trying to keep these things short, but that was a pretty long one. Then we talked about how to individually cater each person to their blood pressure treatment, having precision medicine. And that's what's in the future. We're trying to get medicine that can be tailored to the individual. And that is something that like is really the big thing right now, especially with AI, how to get everything to be like the treatment that will work best for you as a person, not just like everybody gets the same medicine, because we know that it works for some people and doesn't work for other people. So we have learned that it's best with using 2 different molecules to treat high blood pressure at a time, and not just use one. So there are combination medication which have 2 different molecules in them. And they probably have different names in the US, so I won't say them, but using those is really good because it really helps the blood pressure in a better way than just one single molecule would. So it's good to choose. We're trying to figure out which combinations are good to choose, and we don't really know yet. Usually there are 2 types, the calcium blockades and the RAS system blockades, which are the most common types. But it's not good to use two which are within the same family. So use one from two families, basically, and start with that. And the most important people to check for high blood pressure are people who are middle-aged. So basically when you're around from 40 to 60, basically, it's not that important if you have high blood pressure when you're older, because you won't get all of the problems that it will lead to. It will take 10, 20 years before you will get the problems like strokes, heart attacks, and all that. And high blood pressure is the most important risk factor for early death in globally and in Sweden. Now, let's go to the next one, which was, it's this woman. She said, when we follow evidence, there is no polypharmacy. Polypharmacy is having 5 or more medications at the same time. In certain definitions, it's having 10 or more medications at the same time. And that's a really big problem, and it's very, very common. People who are old and who have several diseases, it's often that they have 10 or more medications. Often it's because we're treating a lot of diseases rather than people. And that's because when people are old, they have a lot of different diseases, but maybe they don't want to have all of these medications. Maybe we should take these out, like stop with, discontinue certain of the medications that they have on their list. And the reason that the medications stay on their list in their journal is because we don't do control, like we don't regularly follow up these people. So then they're like on the same medication forever and ever. Also, there's a problem that if a person goes and visits a cardiologist and then visits like a kidney doctor and then visits a lung doctor and then visits the rheumatologist and then visits their GP, it's like the GP is maybe supposed to kind of have control of it, but we're not really sure, like, you know, the GP can't know like what heart medication is always the best for the person who has a cardiologist. And so to have all of this interconnectedness between professions, between specialties, is difficult. And the more medications that you have, the less compliance there is. And compliance is that basically the patient doesn't take their medication like was advised. So that's a problem. Like, you know, if you have so many medications, how are you going to, you're just overwhelmed by the amount of medication. Also, these things cost a lot of money, not just for the patient, for the healthcare system, but also because people with too many medications basically end up in hospital more often because of interactions between medications and because of side effects of different medications. So the life, like if it's an old person who has a lot of medications and a lot of disease, we need to think about the life quality of these people. Do they really need to take 15 different medicines in the morning? Like, are these helping or are they like hurting the person? So have the patient in the center and like go through the medical list and do that. We have that at my workplace, where if a person has more than 10 medications, a pharmacist will come and help us go through the medical list to see like the interactions between the different medications and the side effects and the dosages and everything, to make sure that everything that we do is useful and actually helping the person and not like just making their life miserable. So that is what, and also when an old person is sick, always think, is it because of their medication? So that was that. Then we've got compliance. Well, compliance basically how to make people take their medication. And not taking your medication is defined by taking less than 80% of the dosage that you're supposed to be getting according to your doctor. Often people finish too early. They just like don't pick up the medicine. You know, there's that too. They don't go to the pharmacy once the doctor has prescribed the thing. They don't take it correctly. And that is especially true of inhalators because they don't know how to use their inhalator. Or they do the wrong dosage, either like by mistake or because they don't trust the medication or they don't trust their doctor. There's a lot of things that can be wrong here. And it goes down, compliance goes down, like less people take their medication, all of their medication, if they have polypharmacy, too many medications. And that can lead to people dying. It can lead to complications. So we need to think, why do people not take their medications? It's either because of the patient, okay? That can be either because their beliefs or because they don't want to, or because they're old and they have dementia, or the person themselves doesn't, has a hard time understanding instructions. There are many reasons. There's also the therapy factors, like if the therapy is too complicated or the patient hasn't understood the therapy, then or like the therapy just like makes you need to have several tablets at the same time for this therapy, then it makes it more complicated. It can also be this health system. If certain medications aren't available always, or if the doctor doesn't really know what they're doing, or if the pharmacist decides that they tell the patient that this medication won't work, so they don't give it out. That doesn't happen very often, but it's often that they tell them that, I don't know what your doctor was thinking there. Socioeconomic factors, basically, it costs too much money to get the medication. It can be because of the disease that leads to problems with taking the medication, like inhalators for asthma or that kind of thing. It's hard to use it. And so we need to have practical solutions to this. So instead of asking, as a doctor, do you take your medication? It's better to say, have you forgotten to take your medication this past week? Some medication, a certain tablet. People are more likely to answer positively there. And to write long prescriptions rather than just like something that is 30 days or something. Write 90 days or prescribe for a long period, unless they're addictive substances. One thing that was for the future is maybe one day we can have one pill that has all of the molecules that you need for all of your diseases, that is specifically precision made for you, and you just need to take one of that tablet per day, like a multivitamin kind of, and that would help a ton of people take their medication, because it would be so much easier for them. But we're not there yet. Or an injection every year. We have certain kinds of injections for osteoporosis, for example, that you take once a year, and it lasts all year. So you don't need to remember to take it every day. Then there's always an important question: will you take the medication if I prescribe it? Which, more people will say no than we think. It's important to have a good good conversation with your patient. I'm talking to you guys as if you are doctors, but I'm considering you guys my colleagues, okay? My colleagues on YouTube, my INFP colleagues, okay? And it's important to, if a person can't deal with it on their own, that they can have their family help them, or somebody that they know help them, to take away all unnecessary medication and to synchronize the prescriptions. Then we got into this young girl, woman. She talked about heart sounds and heart murmurs. And we went through different heart murmurs. I don't think that it's very important for you guys, but it was talking about the heart murmurs come from the different valves in the heart, and if either that they're too tight or they leak. And it makes different sounds. So she had like recordings of the sounds that come into the stethoscope. And young people can have these kinds of things as well as old people, but for different reasons. Young people, it's often because of an infection or drug use, IV drug use, or if you are born with a problem that is discovered later. While older people, it's because they have heart failure, most likely. Basically, you should take an ECG, you should do an ultrasound of the heart, and take a blood test. There's a blood test that is good for heart failure to know if you have heart failure. And if you have a problem with your valves, then if there's a lot of problems, it's every year that you do an ultrasound of your heart. But it's every 3 years if it's less, like if it's just a little problem. Because it doesn't always give symptoms, but sometimes it does. And it's usually that you get tired, you feel short of breath, and you feel swollen in your legs and feet. That's the symptoms, the symptom triad for heart failure. Then there was a cardiologist who talked about how you operate on hearts, which I skipped. I skipped because I was tired and I wanted to eat lunch, basically. But nowadays we have regular, like, mechanical valves and biological valves, and you can go through a catheter to the vessels in the heart, and so you don't need to do open heart surgery anymore. So that is very, very useful. Now this guy was sick, so we did not get him, so we got to eat lunch earlier. So those were the things that had to do with how do we optimize medical treatment. I'm going to be making a new one. I'm just going to be making videos on a row. So the next one is going to be about asthma, and see you next time. Bye.